people perceive abortion as criminal, number one, number two, as immoral, and number three, of killing of a baby.
Yeah.
I think that's how they perceive it.
Okay.
But what abortion really is the medical termination or the medical cancellation
Yeah.
or the ending of a pregnancy. You are pregnant with a fetus
Yes.
which hasn't developed,
Yeah.
and you want to terminate, you want to end
Yes, the pregnancy journey.
the pregnancy journey. So that is what abortion actually is.
Welcome back to Quad Conversations. This is where you have the real conversations when it comes to healthcare and healthcare access. Because let's face it, we live in a wonderful country, diverse, cultural, society, religious beliefs, your neighborhood beliefs, what your friends think. All of these things intersect and affect how we access healthcare or even how we talk about access to healthcare. One thing that I really want us to talk about, because it's not talked about enough, it's hush hush, because of exactly these issues: culture, religion, what our neighbors think, what the church thinks, what the principal thinks, all those things. We are hush hush about abortions, access to abortions, and we are going to call them exactly that: abortions. Nothing fancy like terminations or what's this, fetus deletus. There's different ways of talking about abortions. And I'm not alone today. I am joined by Miss Leigh-Ann Carey. She is a PR and communication specialist, but most importantly, she's a terminations activist. Hi, Leigh-Ann.
Hi, doctor.
Welcome to Quad
Thank you for
Conversations.
having me.
Terminations activist. What exactly does that mean?
I don't even know if that's a real term,
Yeah.
but um, how do I put it? I lobby, for
Yes.
want of a better word, for access to abortion,
Yes.
especially in underprivileged communities, in communities where abortion is not very easily accessible.
Accessible. Yeah.
Yeah, so that's
How
what I
do we
do.
how do we even get there? I mean, maybe let's start with legally. How did we get legally to a point where we said this is legal and this should be accessible?
So I think the whole thing came around 1996. I think after 1994, when especially a lot of black people or people of color were getting access to a lot of things, access to voting, access to, equal opportunities to their white counterparts. I think that's when the need or the realization came that women have rights. They have rights, and these rights are reproductive rights.
Yes.
And they need to be put in place and they need to be legalized. So I think it came from, after 1994, democracy, when our access to a lot of things was open.
Yeah.
So that's when it
Yeah,
came
because
in,
we've
yeah.
always said access is an equalizer.
100%.
All these things have always been accessible to other people and
100%.
not us. And it's not like us coming in and saying, change the rules. We're just saying,
Give us access.
give us access, make the playing field level. Why do we then have activists when this is on paper? Why do we have an activist?
South Africa is a wonderful country. We have wonderful laws. But unfortunately, people are not very excited about implementing these laws and these regulations and stuff. And even though abortion is legal, even in a public hospital,
Yeah.
we still have to fight to get access to abortions because
Sure.
South Africa is also very religious. So we have Christians, we have Muslims,
Yeah.
and a lot of the times, healthcare providers that are very religious are anti getting the
Yes.
abortion done,
Okay.
And I think at the core of abortion, what it is, it's a medical procedure,
Yeah.
you know, and medical practitioners have no right to deny people healthcare. You may not agree with the procedure that I want. I could want double D's. Kinzikinality double D's, but
Yeah.
as a cosmetic surgeon, if
Yes.
I want that,
Yes.
if I'm paying for that,
You have to
you
give
have
it.
to supply, and I think that's, sort of making light of the situation.
Yeah.
But people have the right to healthcare.
Yeah.
And when we talk about reproductive rights, abortion is one of the key factors.
And one of the oaths that we take as medical practitioners is to do no harm. and it is huge. Like, we do good and do no harm.
100%.
And unfortunately, when we deny people care or access to these abortions, we might be doing harm.
In fact, you are doing harm.
We are
Yeah.
not even we
You are.
might
Yeah,
be.
you are
We
doing
are
harm.
doing harm. At what age can a woman, or let's say a female, yes, can a female request an abortion?
So, at any age, if you're pregnant and you want an abortion, you can get an abortion. In most instances, it's very tricky for women under the age of 18 to access abortions, because you get to a clinic, you unfortunately happen to know the nurse.
Yeah.
She refuses on a lot of bases. You're young, number one. Number two, a child is a blessing, but not for everybody.
Yeah.
Where's your parents? Why are you having sex? So those are the sort of key things that play a role in stifling
Yeah.
the abortion process, because it's a seamless one.
Yeah. But what does the law say when it comes to
So
that?
there are no age restrictions when it comes to the laws in South Africa.
Yeah.
If you are pregnant and you want an abortion, even if you're 12-year-old, you can access that.
Okay.
You don't need permission from an adult. You can go to the clinic at 13 and 14 and request for an abortion. So there are no age restrictions when it comes to termination of pregnancies in South Africa.
All right. So you talked about like culture and religions, and how do we have these conversations in a way that is sensitive to the cultural beliefs? Like, how do we approach this? Like, because now people will start and accuse us of what's this disregarding their beliefs and things like that. Where's the line there?
I think that's a very, very tricky sort of, topic to handle. But I think what we need to remember is that, our religion is personal to us, and we have no right to impose our religion to the people that we service. And I think what public sector workers especially need to understand is that their job is to serve the public. And I think once they, understand that, it might make it easier for them to do their job.
Yes.
So I think conversations need to happen around what you personally believe in and what you promise to do in terms of the work you do.
Yeah.
Your job is to do no harm.
Yeah.
And you denying me a termination is doing harm to
It's
me.
doing harm to
So I think we just need to, have the conversations, separate the art from the artist. It's fine if you are a Christian, a Catholic, a Muslim, and you believe in certain sort of religious things, but it's not okay to impose those beliefs
on my patients.
onto patients. It's unacceptable, actually.
It is unacceptable. Yeah. And what harm are we doing? Maybe let's start breaking down this harm, because like that person that feels like they have a right to say no to giving care to me. What harm are they doing to me?
Well, I think you are giving illegal abortion providers airtime.
Yeah.
And in the process, putting the lives of women in danger.
Yeah.
Right? Me accessing a backdoor abortion, knowing that it's wrong, because most of the time they know that it's wrong, right?
Yeah.
But because they are desperate to terminate. So what you are doing is pushing me in a situation that could potentially kill me.
Yeah.
Right? So
and
that
we know of women who have actually died from
100%,
from the complications
100%.
of this.
And I think that stems from, nurses and even doctors in the public sector, because face it, in South Africa, a lot of people cannot afford abortions. Abortions are very expensive.
Yeah.
Right? So if I don't have 3,000 Rand for a medical abortion at 6 weeks,
yeah,
and an illegal service provider says 800 Rand,
yeah,
I'm going to raise it quickly because that's more than 3,000 Rand.
yes, and
So
you're gonna go there.
And I'm going to go there. So you are basically pushing these women in danger holes,
Yeah.
and we should not be doing that.
How do people identify illegal providers? Because I really think some of the people pose as proper abortion providers, only to find out that like this is backstreet.
I think it's very simple. South Africans are very conservative. We mentioned religious and cultural beliefs. So abortion is not something that we talk about easily.
Yeah.
So if there's a poster on the side of the road that says cheap, easy, painless, that's how you know.
Yeah, number
That's
one.
how you know. Because even, private medical surgeries do not advertise abortions explicitly. They will
Yeah.
say reproductive health,
Yes.
and you will have to put one and one together,
In
right?
order,
They will never say
and maybe there'll be
abortion,
word of mouth referrals.
100%, you
Yes.
know? So in most instances, it's just easy, painless, cheap, a number. If it's advertised explicitly, that's a red flag.
Okay.
And if it says painless, that is a red flag.
Because it's
A,
painful.
a lot of medical procedures are painful.
Yes.
You know, face it, even if it's just a day surgery,
Even an injection is painful.
that
Yes.
even an injection is painful. So there is basically no medical procedure or any, you know, thing that has to do with medicine that is particularly not painless, you know.
Yeah.
So those are some of the things that you have to look out for. And also, if it's in a building, if it's in a building somewhere
And you have to hide,
and you have
then
to
go
hide, you
up
have to
the
go
stairs,
upstairs or
and then
go in a
around the
basement,
corner.
then you know that.
Yeah.
And in most instances, they are always done by men.
Yeah, yeah.
And that's a red flag, I think. And I don't want to be, you know, like, I don't want to sexualize the profession,
Yeah.
but in most instances, a lot of nurses give basadi,
Yeah.
midwives give basadi. So even abortion providers, in most instances, give basadi. So a
Yeah.
midwife can perform a medical termination, for example.
Yeah.
So those are some of the red flags. And also, they won't do a proper scan.
Yes. Yeah.
Because they don't care to know how far you are. And in most instances, they'll still give you tablets, even when you know, past a certain date,
Yeah.
because there are two medical procedures.
Okay.
So you can't take pills after a certain time has elapsed in your pregnancy. So
Yeah.
those are just some of
I
the.
don't know if there's an answer to this, but do you think there's portals or places where people can check where, like, who the reputable abortion providers are?
So the Mail and Guardian has a list where you can access legal termination providers. So that, and it under their medical publications, so you can check online. And you can also check with the HSPCA.
Yeah.
Every medical provider that I've gone to,
Yeah.
I've always checked. I think one of the other things that we need to do as patients is take medical care in our hands.
Into our hands, exactly.
I can't just go to a doctor and have a doctor dump medication on me. I need to read and understand and see what it's for. I've been given medication, for example, Yamoto or diagnostic HIV.
Yeah.
But because I did my research and I read, it gave me a better understanding as to why. Because if you give me something and I'm like, but I'm not HIV, it doesn't mean it's going to do me any harm.
Yeah.
But I think we also have to take that in our hands,
the
try
health
to
into-
understand
Yeah.
what is going to be done to you as a patient by the doctor and ask questions.
I love that, Leigh-Ann, because also the woman that is coming to access an abortion, they need to understand what medication they are given, how it's going to act, what to expect, how do things look when things are not going well. You know, because that conversation, I think, hardly happens with a lot of people when they access care. Like, you know, like, yes, I'm going to bleed and there'll be clots and what, but how long should I be bleeding?
100%.
You know, okay. I wanted to ask you about, like, psychological impact. This question is for someone who is accessing an abortion in the right way. Are there psychological impacts, like, that you have heard about in patients that access abortion services?
I think not really extreme psychological, you know, after effects. In most instances, women do feel a sense of relief after having an abortion. I think one of the things that might make them feel bad for having having had an abortion is the stigma. They can't freely speak about having had an abortion.
Yeah.
So those are the sort of things that, you know, that eat them up, that I can't, nobody can know that I've had an abortion.
Yeah.
But in most instances, it's a feeling of relief. And, you know, I don't have to be pregnant anymore because I don't want to.
Yeah.
So no serious psychological, you know, effects. I think the cases that we've seen are a bit weird, you know, not weird, but the numbering. We don't get a lot of people coming and saying, I regret having an abortion.
Yeah.
It's mostly, oh my gosh, I'm glad that I had access to an abortion. And I'm glad that I can take a different direction with my life. So there are no mental or psychological effects
Yeah.
from people that have had abortions. They don't particularly feel suicidal.
Yes,
Um,
especially when it's a choice, right? Because we must never forget to talk of cases where someone may be coerced
yeah,
into having an
yeah,
abortion. Maybe say you were in a relationship that
yeah,
was not so cool, and this person does not want you to have
yeah,
a child, and you do want to have a child. You are forced to do an abortion. Obviously, there'll be a negative mental health,
100%.
impact there, or maybe it's parents,
Yeah,
forcing you
yeah.
to do it because maybe you're still in school,
Mm,
but you know that you still want to have a child. Stigma, there's a lot of stigma that you just spoke about when it comes to abortions, and people like being embarrassed about it, not wanting to share it. The impact of social media, there's a lot of negative talk, around abortions and women who choose abortion. How do we drive the conversation in a better direction? What role can we play as health providers, but also as you activists in getting the conversation to be a better one?
talk, 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 and more talk.
Mm.
I think when we talk to certain things, when we educate ourselves, when you educate other people, I think people have a better understanding of what abortion is. I think in most instances, people judge abortion because they don't know what it is,
Yeah.
right? So I think we need to talk to abortion, what it is, and how life changing it is.
Yeah.
I think people often think it's women being selfish, but there are women that can share real life stories about how terminating a pregnancy changed their lives for the good.
Yeah.
So I think we need to talk a lot about abortion, talk as often as we can about abortion,
Mm.
and make it a part of regular conversations. We don't even have abortion conversations with our moms.
Yeah. Yeah.
We don't
Yes,
have it with
but we
our
don't
lady
talk we
friends.
don't talk a lot of even other sexual things with our
And we
moms.
should have those
Yeah.
conversations. And I think we are moving into an era where information is so accessible, but it's also not the correct
It's
information.
not
It's not
regulated.
regulated. So you want to have conversations with the right people to equip yourself
Mm.
with the correct information.
Right.
Yeah.
And how do we support, like, yes, what type of support should be available for women who, number one, want to do abortion, number two, who have done it and they feel like, or who just want to access information so that they are better equipped to have better
I
conversations?
think one of the ways we can support is to make sure that it's out there.
Mm.
Don't hide it. Don't criminalize it. Abortion is not a criminal offense, it's a medical procedure,
Mm.
right? Um, like I mentioned before, talking about it, that is a form of support, right?
Mm.
Because in fact, a lot of women have had abortions, but they can't talk about it because they feel like some type of way. So what we can do is also not only talk about it, but listen to people that have had abortions and
Yeah.
understand why, if they are willing to share why they did the procedure.
Mm.
And number two, we can donate funds, we can donate time. All the abortion work that I do is I've used my own resources, right?
Yeah.
So donate time, donate money, you can donate your services, you can educate yourself because that's also a form of support.
Yeah.
If you're trying to figure out something about somebody or about a certain issue, educating yourself and trying to understand is also a form of support.
It's a
Yeah,
form of support.
yeah.
Yeah.
It shows that you care enough to want to understand and want to know why this is happening or why this is this way, for example.
Okay. And practices like ours, like Quadcare Medical Centers, provide, abortion. So what role do you feel practices like Quadcare play in society, like as an activist?
So, I'm not going to mention names, but there is, one of the biggest service providers, which is a, private sort of, service provider, and they have explicitly made it clear that they provide abortion. So I think, in your case, you are like a sort of family-based surgical um, provider. You do depot, you do like general health stuff.
Mm.
What you can do is say, we provide abortions
Yeah.
instead, and I know it's not very easy to do, but saying you provide reproductive services to a lot of people is like, I'm just going to go get there and get a contraceptive. That's it. I'm going to go get condoms
Yeah.
and, get a needle in the bum and that's it.
Yeah.
But you can say, if you
Explicitly.
want an abortion,
Mm.
this is where you can get an abortion. We do medical abortions. unfortunately we don't do surgical for whatever reason. So I think
Yeah.
making it explicit, making people aware that those are some of the services that you provide can make it easier as well, instead of, you know,
Yeah.
making it a bit discreet, because it also doesn't feel like you are, you know,
Providing the
providing the services, you know, because now you put in under an umbrella service of
okay, of
reproductive
sexual and
services.
reproductive health
100%,
service. Okay.
100%.
So Leigh, there's a lot of misconceptions, other perceptions, misunderstandings when it comes to abortion. You know, when you ask any person what is an abortion, I'm sure we will hear horror stories.
So I think, let me get into the perception first. I think
Yeah.
people perceive abortion as criminal, number one, number two, as immoral, and number three, of killing of a baby.
Yeah.
I think that's how they perceive it.
Okay.
But what abortion really is the medical termination or the medical cancellation
Yeah.
or the ending of a pregnancy. You are pregnant with a fetus
Yes.
which hasn't developed,
Yeah.
and you want to terminate, you want to end
Yes, the pregnancy journey.
the pregnancy journey. So that is what abortion actually is.
Yes.
Yeah.
So it is a medical procedure
Medical
that is
procedure.
performed to prevent a pregnancy from continuing.
100%. That's
Yeah.
all it is.
Okay.
That is the actual definition of what an abortion is.
All right. So now, once one has done an abortion, are they able to fall pregnant later? Like later when they are ready and want to have a baby, what has been the experience?
100%. You can have 5,000 abortions, you can still fall pregnant.
All right.
If you have an abortion at a registered medical service provider,
Yes.
you should be able to fall pregnant even the next month,
Okay.
right?
Yeah.
Because they do it the correct way. It has no harm on your reproductive, you know, sort of functions.
Yes.
It does no harm to you. If you do it on a legal service provider, unfortunately, we've seen a lot of people that have had backdoor abortions that have almost died, and in some instances, unfortunately, have died. And you know, some of them aren't unfortunately able to fall pregnant after because it's not done the right way.
Yeah, because there's usually like instruments that
Instruments that are
that could
used
damage
that are also
your
not very
reproductive
sanitary, and you know, so there's just a lot of
infections
infections.
that
100%,
yes, because
100%.
we have seen cases of infections. Maybe let's like I think this is something that I should answer more, but it's really around what people can do if they have gone the illegal or back street route, you know, because people go there and they have complications, but because they have done it, they are scared to come back to us and say, please help, I have done this and now I'm bleeding uncontrollably, or there's a smell that is coming out. Do come still, you know, do come to Quadcare, do go to your medical provider and get treated. You know, there is nothing that says because you have gone that route, like now you are discarded by the system. You can still come back, you know, and be managed.
100%. And I think be honest in the process, you know. But I think because women find it so difficult to go to a clinic in their area,
Yeah.
it's even tough to go back, because when I get to the clinic and I see Masi Mangmang that's
Yeah.
friends with my mom,
Yes.
how do I now say I
I
have
have
had
done
an
this and now I'm here.
if anything, you were supposed to be my starting point as a public health provider, right? I'm supposed to start and say, I'm 3 weeks, 6 weeks pregnant. Unfortunately, I can't continue for whatever reason. Or fortunately, you know, I want to access an abortion,
Yes.
right? So it makes it very difficult to go back to the source, because that's
Yeah.
the source.
Yeah.
A public hospital is a source, a Quadcare is a source. But if you find yourself in a very tricky situation where you are bleeding nonstop, go back and be honest,
Yes. And
right?
say
So that
this
you can
is
get the correct care.
yeah,
Yeah.
honesty, right?
Honesty.
Thank you so much,
Thank
like
you
you
so
know,
much.
Leigh-Ann, for having this conversation with us. And like you say, we must talk. This conversation needs to happen in all our corners, even on social media spaces. When you see negative commentary happening around abortions, please do share your best. We are equipping you to be an activist too. So you are now a termination activist by being with us, you know, today. And I think there's a call also that you made to us as health providers to do no harm. And when we deny care, we do harm. And unfortunately, then people go to these backstreet places and end up dying, or having complications that prevent them from having babies later in life. Thank you for so much for having this important conversation with us, and thank you guys for joining this conversation. Remember to be advocates for abortions, from now on, and we will see you next time as we talk about other important health topics that we don't get to talk about enough, with our health providers and also in our communities. Remember to always hashtag feel better, and see you at the next one.